Hello, everyone. Thank you for participating in today's webinar on the role of genetic counselors on the Pompe disease care team. Today's guest speaker is Erin Huggins. Erin is a board-certified genetic counselor in Durham, North Carolina. She received her BS in biology from Coastal Carolina University in 2016 and her master's in genetic counseling from the University of South Carolina in 2018. From 2019 to 2024, Erin was a member of Dr. Priya Kishnani's Pompe disease clinical and research team at Duke University, where she participated in numerous research activities related to lysosomal and glycogen storage diseases, with her primary interest in newborn screening for Pompe disease and clinical variant interpretation. In addition to her research role, Erin provided clinical genetic counseling for patients across the lifespan with a variety of inherited metabolical disorders. In 2024, Erin stepped down from her role on Dr. Kishnani's team to pursue her PhD in molecular genetics and microbiology at Duke University, where she continues to contribute to research related to Pompe disease. Throughout the presentation, you can send questions at any time by clicking the Q&A feature at the bottom of the Zoom window, and Erin will answer the questions at the end of the presentation. Thank you so much for joining us, Erin, and for giving this talk. And with that, I will turn it over to you.
Awesome. Thank you so much for that wonderful introduction, and thanks for having me back. I'm going to go ahead and get my slides up. 1 second. All right. Are you able to see the correct slides, Matt?
Yes, we are.
Awesome. All right, cool. All right, all set. So thanks again, everyone. It's really wonderful to be here. Thank you to Matt and the AMDA for coordinating all of this. So today's webinar is called The Role of Genetic Counselors on the Pompe Disease Care Team. And I've been really excited to give this webinar because it's always really fun to talk about my background a little bit and how people who are trained in genetics and genetic counseling can help you along their journey. Before we get started, I wanted to go ahead and dedicate this talk, this webinar, to our dear friend Tiffany, the president of AMDA, not only a Pompe disease advocate, but also a friend and colleague. And I'm just so grateful to Tiffany for reaching out to me and getting me involved in the AMDA and, kind of allowing me to even be here today. She set this up to begin with. And so I just wanted to put this in there for her, and we miss her dearly. All right, so to kick off, I wanted to kind of give a little bit about my background. So as Matt said in his introduction, I received both my bachelor's and master's degrees in South Carolina. And I received my master's in genetic counseling from USC. My first job out of grad school was actually at a small community hospital in South Carolina, where I practiced cancer genetics for a little over a year before I moved on to my pediatrics role at Duke University Medical Center. And that's where I practiced under Dr. Kishnani for about 5 years. I worked on the clinical research and the Pompe clinic side, so I got to be really involved in a lot of different activities related to Pompe disease. And that, after a few years, prompted me to go back to school. So as mentioned earlier, I'm still at Duke. Of course, I'm now a first-year PhD student. And my research project is still in the realm of Pompe disease. So it's really awesome to still be involved at all these different stages of my life. I'll do a quick overview of all the things we're going to cover today. So first, I want to give a definition of genetic counseling. We'll talk a little bit about the types of training, certification that genetic counselors go through to be able to practice. We'll talk about the different roles, not just of the genetic counselor, but on the clinical genetics team. We'll talk about what actually takes place during a genetic counseling visit, and of course, how genetic counselors specifically can support the Pompe disease care team. And I hope we have time at the end for a Q&A. If you have any questions during the presentation, feel free to put them in the Q&A box, and I will address them all at the end, or I'll do my best to address them all at the end. All right, so what do genetic counselors do? Who are we? So I've included a couple of different definitions that I actually found online because I Googled what is a genetic counselor? I wanted to see what, because I know what a genetic counselor is, but I wanted to see what the internet said. So I found a few. These are a few of my favorites. So this is a definition from the NIH, referring to genetic counseling refers to the guidance relating to genetic disorders. We're providing information about how genetic condition can, affect an individual or family. The NCI, or the National Cancer Institute, also had a pretty lengthy definition, which I liked: a health professional with special training in medical genetics and counseling. I like that they included both of those things. We help patients and families who have or may be at risk of a genetic condition. I think that's a pretty good summary. Mayo Clinic has a nice definition as well that includes mentioning assessing individual or family history of an inherited condition. So all of these have a few different components. Some of them are very long, but I like the short and simple definition from the National and Society of Genetic Counselors, or NSGC. The genetic counseling is the process of helping people understand and adapt to the medical, psychological, and familial implications of genetic contribution to disease. I really like this one. This is the official definition. So with that, I want to go ahead and get more into what it is we actually do and how we help those things happen. So a few things I think genetic counselors can do. So one, we can assess your risk for a genetic condition based on your personal or family history. We can offer guidance on what type of genetic testing might be the most appropriate for you and help you understand those genetic test results. We can also help you talk to your family about your genetic test results and coordinate testing for them if needed. Not only that, but we also provide support for people adjusting to living with a genetic diagnosis, maybe for themselves or for their child. A few things genetic counselors cannot do to kind of distinguish us from other healthcare providers. We can't perform any kind of medical procedures. We're not trained to do anything like that. There may be some of us who have gotten some kind of special training, but in general, that's not part of our training. We can't make decisions for you about your medical treatment. We can't order any non-genetics related testing. We can't disclose any healthcare information or genetic test information without your consent. I always like to mention that because this isn't information that we get and then are able to share even with your other providers without your permission. Unfortunately, we can't interpret your 23andMe or Ancestry.com data. That's how most people hear about genetic testing these days, but that's not something that we're really able to look at for you. And we don't make designer babies. I put that in there because I get this question a lot. That's not what our job is. And so I always like to mention it, that our job is to assess your risk for genetic condition, do the testing, and help you, understand those results and move along. Right, so how to become a genetic counselor. So most genetic counselors, or GCs, I'll probably say GCs throughout the rest of this webinar, have a bachelor's degree, like bachelor's of science or bachelor's of arts, need to have that in order to enter a training program. Most of us have degrees in biology or biochemistry, like a pre-med field, or even psychology. And some people have an entirely different bachelor's degree, but all of us have completed prerequisites, usually in genetics, chemistry, biology. The programs differ by their requirements, but all of us have some background in genetics before we start. Genetic counselors receive extensive training, of course, in medical and biological science. So we're taking anatomy and physiology, genetics and genomics, developmental biology, entire classes dedicated to doing risk assessment. So very medical-based knowledge. But additionally, we receive a lot of training in psychological sciences. So we do have a lot of psychology training with a focus on healthcare communication, biomedical ethics, strategies for shared decision making, coping, and we're also trained on different cultural and religious competencies. So all of that to say, I think genetic counseling is the perfect marriage of science and healthcare, meeting communication and support. So to me, it's a very holistic medical profession where we have, of course, the biological and medical knowledge, but also the human side of things where there's a person on the receiving end of all of that information. And we want to know, how can we best communicate to that person to increase their standard of care? As far as training programs go, there are over 50 accredited programs in the USA and Canada. I do think there's a couple across the world that aren't in USA or Canada. I can't name as many off the top of my head. But this is a really awesome growth. To compare it, when I applied to genetic counseling programs about 10 years ago, there were only 30 programs. So it's been really awesome to see the growth, more people interested in the field. And these programs are accredited by the Accreditation Council for Genetic Counseling. So there's its own kind of governing body for that. So basically, not just any school can say, oh, we're going to have a genetic counseling training program. There's steps you have to go through to basically make sure that's a legitimate program. These programs usually last about 2 years and result in a Master of Science or MS degree. There's some programs that have dual degrees, usually with another master's or even a PhD in genetics. But the vast majority of us graduate in 2 years with our master's. After graduating from an accredited university, we are eligible to sit for the board exam, which is specific to genetic counselors. That's set up by the American Board of Genetic Counseling. And we can usually sit for that within a year to two of completing our program. And once you pass your board exam, you are then a certified genetic counselor or CGC. On top of that, some states in the US require licensure for genetic counseling or genetic counselors to practice. Not that is true for maybe a third of all states. They each have their own kind of requirements to go through. But that's not, so for example, I live in North Carolina, that's not a requirement here. But a couple of notes on that, if you're ever looking at someone's credentials, most genetic counselors that are hired right out of graduate school aren't yet certified, meaning they haven't sat for that exam, but they're still qualified to provide your medical care. There might just be some limitations on what they can and can't do, or what they might need approval from a physician for. Like I said, licensure not required in all states. There's no like additional qualifications or training or anything. So a licensed genetic counselor isn't necessarily more experienced or more highly qualified than somebody without a license. So I just like to put that out there in case you're ever trying to figure out the jargon, the jumble of letters at the end of our names. So during our training, we go through these clinical rotations. So our first year is really just coursework, all of the things that I mentioned on the prior slide. And our second year is a few more courses and clinical rotations. So very similar to students when they're in medical school, they might pick different specialties. Same thing for genetic counselors, we rotate through different specialties. These are kind of the core three that we definitely receive training on during our programs. So I'll touch on those real quick. So the first one is known as prenatal or preconception genetics. And so a few things that might be done in this kind of genetic counseling. So maybe carrier testing before or during pregnancy. If you're going through pregnancy and there's an abnormal finding on the ultrasound, or you're considered high risk for some reason, maybe due to advanced maternal age, recurrent miscarriages, or a previous, family history of a genetic condition, that might be a reason you'd see a genetic counselor. We can offer routine screening during pregnancy and provide risk assessment, of course, based on family history. Another thing a lot of genetic counselors are getting more and more involved in is assistive reproductive technology, or ART, as that field has kind of expanded. So genetic counselors are involved in IVF, so in vitro fertilization. Usually that involves pre-implantation genetic testing, so where genetic testing is done on the embryo before implanting it into the mother. Working with individuals using sperm and egg donors, so on and so forth. So it's a really unique space to get into right now. The second kind of major specialty is oncology or cancer genetics. And so you might see a cancer genetic counselor if you have a personal or family history of cancer that suggests maybe there's some kind of hereditary component. There's a lot of risk assessment, of course, happening in cancer genetics. You might have cancer yourself and want to know, does having a genetic condition impact my eligibility for certain treatment strategies or certain medications or clinical trials even. So it's becoming more and more useful to get genetic testing as part of routine cancer workup. And then, of course, if you have a family history, but you yourself don't have cancer, like I said, you can still meet with a genetic counselor. They can offer testing if it's right for you and guide you through that process. And that's the field I actually worked in before coming to Duke and switched into pediatric and adult genetics. So a little bit different. We're usually, I'll say in prenatal and preconception, we're usually working as part of like an OB/GYN or maternal fetal medicine team. And oncology, working with breast surgeons, medical oncologists, really big team there. And pediatrics and adults, there's usually a dedicated genetics clinic. Now, that's not always the case, excuse me, but most of the time you're going to be working with an MD geneticist, an actual genetics team. And so this might be the case if you have a personal or family history of a known genetic disorder, like something outside of the cancer world. If there's any medical or developmental concerns that suggest that genetic disorder might be the cause, treatment or trial eligibility, and testing other family members and discussing possible disease recurrence. Sorry. Sorry about that. So like I said, those are kind of the core three specialties that we get trained in, but some people choose to subspecialize. Cardiology is a common one. Excuse me. Neurology. Then there's a lot of like epilepsy disorders. Sorry. Excuse me. Epilepsy disorders, metabolic disease, which is what I specialize in, managing patients with Pompe, and many more. One thing I want to mention is that all genetic counselors that graduate from an accredited program are qualified to work in any specialty. So we can graduate and really go into any field we choose, which is really awesome because we're equally trained across the three major ones. And then within that, that kind of covers those subspecialties that you can get more training in as you continue to work. But there aren't additional certifications or residencies like a physician would do, for example. So next, I want to talk a little bit about that clinical genetics team that I mentioned in the pediatric and adult space. So most of you on this call, this is probably what you're most familiar with. So I have clinical genetics in the center here. It's made up of a lot of different people. This isn't even everybody. This doesn't even begin to cover it, but this is kind of the core group. And especially if you come to our clinic at Duke, you will meet all of these people. So of course you have our geneticist. That's going to be down here in the purple. I'm not sure if you can see my clicker here. So this is your physician who went to medical school and has specialized training in genetics. So this would be Dr. Kishnani for anybody who's familiar with the Duke team. You have specialty providers like speech therapy, physical therapy, PAs, nurse practitioners, other allied health professionals, social workers, for example, clinical nursing. So nursing might help out with, medication management, enzyme replacement therapy, or just basic medical needs. Your genetic counselor is always a part of that team. Most teams have a registered dietitian or RD on staff as well. And a research coordinator. If you come to a big university or an academic center like Duke, where we have a lot of different research programs going on, you will almost always meet with a research coordinator. And while research might not be part of your clinical care, it's still part of your overall care. And that's why it's kind of included in this summary. This would be the kind of typical order of people you would see for anybody who's ever visited Duke and been through our clinic. It's a pretty long day. So it kind of starts out with your typical doctor visit. We're collecting height, weight, head circumference, reviewing medications and allergies. And then usually once you're in a room, the genetic counselor is very frequently the first person you come into contact with. So my role here as a GC, I want to go in, and if we haven't met before, I want to get to know you, your child, what are your specific needs, like what can we help you with today? I'll go over this next part in detail in the next few slides, but just in brief, I'll take a detailed family history, a medical history, developmental history, and depending on kind of where you are in your genetics journey, I can provide tests like, pre-test counseling. Are we going to be ordering this kind of genetic test? Or if I have results ready to go, then I can say, here's your results. Let's talk about it. You may also meet with a dietitian depending on the reason you're coming to clinic. In the case of Pompe Clinic, this, you might not always meet with the dietitian, but we do have one on staff who's very wonderful. Research coordinator, like I said, they can give you an overview of what studies you may be eligible for or trials you may be eligible for. And then finally, you meet with the geneticist or the physician, the doctor, who will meet with all of us that have come in and visited your room and gotten different information. And we'll kind of all discuss together. And the physician will go in, they'll do a physical exam, of course, listen to you and your concerns. And then we kind of come back as a team and say, okay, here's what the plan is going to be. Here's the test we want to order, or here's the medication we want to recommend. And then the physician creates a follow-up plan that would then carry on from there. And then you're off to your next specialist, whether it be physical therapy, cardiology, whoever. So what actually happens when the genetic counselor comes into the room and meets with you, or maybe you meet on a telemedicine visit? Usually the first thing or one of the first things that I do after getting to know you is collecting a pedigree or a family history. So this is just a visual representation of a family tree and the relevant health information. So if you've met with a genetic counselor, you may have seen them drawing sticks and squares and circles on a paper, and it gives you something that looks like this. Um, Usually we're asking about three different generations. So you, like let's say this is you down here. I want to know about your parents' generation and your grandparents' generation. Generally speaking, squares indicate males and circles indicate females, and they're always drawn kind of in this, squares on the right, circles on the, or excuse me, squares on the left, circles on the right order. And all pedigrees, of course, are going to be different because we're trying to collect very different information depending on the reason you're seeing us. Um, but usually something like a filled in shape would indicate somebody that, has a genetic disease, or an empty shape would include, somebody who's healthy. Um, the way we collect these is pretty specific to what we're, the reason we're seeing you. So like, for example, when I was working as a cancer genetic counselor, I cared a whole lot about what type of cancer somebody had, how old they were when they were diagnosed, what kind of treatment they got, versus if I'm working in the Pompe clinic, that might not be the main questions I'm asking. I might ask more about, has anybody had an infant or child that's, that had an illness that you weren't sure about, or an older individual that needed a wheelchair? I'm asking more Pompe specific questions. So even if you come in and you say, wow, I have a really big family, this is going to take forever. Remember, we're going to take a very tailored pedigree specific to the information that we need. Um, Drawing these pedigrees is really, really useful for a lot of different reasons. One of them is I personally am a visual learner, so it's really nice to see just basically a picture of what we're dealing with that helps me calculate, what's your chance of having a genetic disorder. Or if you're somebody who's already diagnosed, who in your family might be at risk for also having this disorder. It can also help us determine the inheritance pattern. So let's say somebody's coming in and they don't have a diagnosis. They think something's going on. I don't know what it is. I've got this weird family history. So if I'm able to draw everything out, collect symptoms, information, then I can look at it and I can maybe kind of guess, well, are we dealing with a dominant condition here, recessive? And that can kind of help me narrow down what it is we might be looking at. So there's a lot of reasons this is important, and usually one of the first things done in the genetic counseling visit. So next, I want to collect a really comprehensive medical history. So depending on the reason I'm seeing you, this could start back as early as pregnancy and birth. So if I'm seeing an adult individual, I'm probably not going to get a lot of information on that. But if you're bringing your kiddo to come see me, there's going to be a lot of questions about that. Developmental history, how old were you or your child when they walked, rolled over, talked, all those things. Um, Other medical history like infections, injuries, or hospitalizations or surgeries. Reviewing of relevant medical testing. So have you had any x-rays or imaging done, blood work, biopsies? Have you already had genetic testing done? We'll often do a review of systems, which is just kind of a head to toe, ask you kind of rapid fire questions. Some of us, some clinics actually have a form for you to fill out ahead of time, which is nice. And of course, at the end of all of that, you might say, well, actually, none of that's why I'm here. Here's my specific concern. And at that point, I want you to tell me about it. I get this question a lot when I kind of launch into these questions. Well, hey, I sent you my records. Didn't you read them? Why are we going through all of this? Genetic counselors and the physician as well, we spend time going through your records before we see you. Absolutely. We require them before we even set up an appointment. But kind of two aspects to that. One is maybe you came in with a stack this big and I didn't read every single page and I just want to make sure I didn't miss anything big. And two, record, I'm relying on somebody else's documentation. I want to hear from myself your story and your personal needs. And I'll talk about this a little bit later when we order genetic testing, accuracy in our documentation is really, really important. So yeah, just bear with me if you're answering the same questions over and over again. I know that's frustrating. The next thing genetic counselors can do after we spend forever taking all of your history is, okay, now I've done that and I can say this kind of genetic testing might be right for you. So there's lots of different genetic tests available depending on what the concerns are. So we could look at kind of a large scale, look to see, do you have the right number of chromosomes? It's called a karyotype. If I'm curious about a single gene, like I think, oh, it really could be this one condition, or in the case of Pompe disease, if we already know there's a history, that might be the only gene I test. Or a panel of maybe 20, 30 genes if it's, a bit more non-specific. Or if I'm like, I really don't know what's going on, let me do a really big test, a whole genome or whole exome sequencing, where we look at all of the genes that we know contribute to disease. And so this is going to vary from person to person, and that's another reason collecting that history is so important. So once I kind of decide, okay, this test might be the best, then I'm going to do what's called pre-test counseling, exactly what it sounds like. I take all this information back, I talk to the geneticist, and I say, here's here's the information. Let's decide on the best test. I'll explain to you the methodology and what types of information that we can and cannot learn from this test. Because like I said, there's lots of different types of tests. So we want to make sure we're capturing everything that's important to us and nothing that's not. Usually there'll be a consent form involved, like a physical piece of paper. Sometimes it's electronic, sometimes it's verbal, depending on the test. And what I always like to do is give a timeline for when to expect results. So nobody likes to say, oh, we're going to order this test, and then 3 months later you still haven't heard anything. So I like to give a timeline and then a plan for result disclosure. This is really important because this is really important information that you're going to be receiving. So would you like me to call you? Would you like me to wait for you to come in person? Is it feasible to wait to come in person? Let's kind of set that up. The genetic counselor will also explain privacy laws surrounding genetic testing to make sure you're comfortable with everything that's being ordered. On the other side of things, once I have results back, then I can provide post-test counseling. So pretty self-explanatory. Once a test result comes back, the way the medical record system works now, and actually a lot of genetic testing labs works now, is oftentimes we're getting notified at the same time when your test results are ready. So you might get an email at the exact same time I get an email. The difference is if you get it at 9 o'clock at night on your phone and I'm asleep, then I don't know, I didn't know they came in until the next morning. So sometimes it's possible you see those results before me. So I always try and make sure that that's something people are aware of. And as soon as I get them, usually myself and the geneticist will talk about them together, and then contact you and explain, here's what these results are, what they mean, what your follow-up plan is going to be. I wanted to go into an example of one of the things we would talk about after getting a genetic test result. So whenever we get test results, usually we're looking at genetic variants. And so this is something that I would explain no matter what came up. So variant, I like to call, some people say mutation or change. It's essentially a spelling change in a gene that's different than expected. Not all genetic variants cause disease. So we're not going to see one and then immediately think, oh, this must be causing it. There's a lot of things we're going to look at to determine, well, do we think this is actually causing disease or not? And we can use many different types of evidence to help us classify these variants. So we can say we have enough evidence to say this is pathogenic or disease causing. Say, yes, this causes Pompe disease or whatever condition. You can have a variant that's benign. Maybe it's really common in the general population. It's just a normal variation. Usually those aren't going to be on your genetic test reports. The third type of result you can get is a variant of uncertain significance, or VUS. If anybody's on this call and has had a VUS before, you know how frustrating they can be. Basically, this means there's just not enough of that evidence to determine with certainty, yes, this is pathogenic, yes, this is disease causing, or no, this is just a normal variation. Um, so anything that doesn't fall into those two buckets gets called a VUS. Um, on the right, I just have some examples. We don't have to go through all of them of different types of evidence that we can use. So one of them that's, you know, kind of the most common is, well, has this variant been seen before in somebody with Pompe disease? And if it has, that's really strong evidence to say, yeah, this is disease causing. But if it hasn't, then we have to look at kind of all of these other um, types of evidence as well. So this is just an example of kind of the amount of detail I would go through with you to understand, here's what these variants mean, here's what we know about them. Sometimes it's a slam dunk diagnosis, and I will usually tell you that right off the bat. Sometimes it's not that clear, but I want you to be able to understand what the test is actually saying. All right, so that was one example of the many things we can talk about. So I want to kind of zoom in a little bit on Pompe disease and give some examples of how a genetic counselor can help you or your child navigate a diagnosis of Pompe. So I've talked a lot about this already, but I wanted to kind of summarize it all. And here's where, you know, I see genetic counselors helping out the most as somebody with Pompe. So diagnosis is the first kind of big one, right? Like you get enzyme testing, you get genetic testing, you get all these different results, and what do they all mean? And so that's, you know, when I think about what do I do in the Pompe clinic, what do I do to support my patients? That's kind of the first thing that comes to mind. It's definitely the most common thing that comes up. Um, Immediately after that is, you know, as soon as you get a diagnosis, of anybody on this call, that's happened to them, your first thing, you probably had a million questions, or maybe you're like, what is, I've never heard of this before. And that's when the communication and understanding aspect, you know, that second half of our training comes into play, where I'm going to do my best to take medical jargon and reduce it to simple terms that anybody can understand, or just based on, you know, here's what I know and here's what I want you to tell me. I want to spend time with you to make sure you understand the information. I know all of us have probably experienced going to the doctor and they spend maybe 5 minutes with you and, you know, send you home. And that's not what I want to do in my clinic if I have the ability to spend as much time with you as possible to help you understand. And of course, act as a support person when you need assistance from your medical team. If you're not able to get a hold of your doctor or somebody else, or you just have a quick question, you know, please message me. That's something that, you know, that I can provide to you, just as kind of a step between you and your doctor. And if it's something I can't answer, then I can pass it along to the team and make sure it gets answered. Kind of once you know, that part is, you know, you've got the diagnosis, you kind of understand it, and now I have to live with this condition, or my child has to live with this condition. And so what can the genetic counselor offer me at that point? Like, I don't have to explain the diagnosis to you next time I see you, but what are some things you can do? And so I included advocacy in there because I'm constantly talking to people about insurance coverage, writing letters of support for maybe getting therapies or time out of school or work, um, working on communicating with other medical providers on your behalf. Maybe you say, Erin, I have no idea how to even explain Pompe disease to somebody else. You know, could you write a letter explaining what it is so I can give it to my boss or whatever? So those kinds of things are something that I can help with kind of along as we continue to follow you in the clinic. And then outside of that, just kind of in general, you know, I want to support you navigating the world with a new diagnosis. You know, I don't have the answer to everything, but I can try my best to point you to the direction of somebody who does. So that's, you know, one thing genetic counselors do is we really try and act as a resource. So if I don't know the answer, that's not something I can help with. You know, here's some pamphlets to read. Here's a support group that I think you really like. Here's a clinical trial you might be eligible for. Let's talk about this with your doctor. And then, of course, support in making decisions just about your medical care throughout the lifespan. Um, and then sometimes I'm just a friendly face. You know, if you've been coming to clinic for, you know, 10 plus years, whatever, you see me every time you come, maybe we don't have anything new to talk about, but I find it really important for people who are coming to the genetics clinic very frequently to see somebody they know and trust. And I think building that kind of trust is something that not a lot of medical providers really get much of a chance to do with how quickly they have to see patients. But one thing that's unique about genetic counseling is that that's our whole job, is to get to know you and your story. And so that's a really valuable part, I think, of my job. So going back to these genetic test results, so again, I wanted to use that as the example. So how can I, how can I explain this information in a way that makes sense? So going back to the VUS issue, so one thing that comes up in diagnosis and disease management is we get a lot of these VUSs, specifically in GAA. We're getting these a lot more recently with the advent of newborn screening, not just in the US, but across the world. You might say, why is that? Well, we're testing more people, we're testing more babies, and so that means more variants are being found. Many of these have never been seen before, not just never seen in Pompe disease, but never reported in the general population. So that makes it kind of hard to know right off the bat, what they're actually doing in the body. If a VUS is found in somebody, with clearly deficient GAA enzyme activity, or maybe symptoms of either IOPD or LOPD, then it's pretty straightforward for us to say, okay, but we have a phenotype, and this helps us, um, helps provide additional evidence that this variant might be causing disease. But in the case of newborn screening, some children with LOPD can have early symptoms, but newborns are typically healthy and don't show obvious symptoms at birth. And so that can make it pretty hard to say, like, is this variant actually causing LOPD, or they're just not symptomatic yet, or is it benign and not actually causing disease? And oftentimes we don't really have a way of knowing that. So I have this conversation a lot with people as a genetic counselor, not just for parents of children with positive newborn screens, but sometimes adults even, because the phenotype for Pompe disease can be so variable, and can look similar to other disorders, where if somebody has, unclear genetic test results, we might not know whether yes, this is Pompe or no, it's not. It's not always black and white, unfortunately. So just as an example of things that I'm talking to you about or continuing to think about in the background, even when we're not actively seeing you in the clinic, always trying to understand these variants. What do they mean for patients? What do they mean for us? And how can we learn more about them? And finally, I just wanted to talk about like patient navigation. I learned this term actually when I worked in a cancer clinic. I met somebody who was called a nurse navigator. And her job really was to get with anybody who had been newly diagnosed with cancer and help them navigate their diagnosis and treatment and like living life with cancer. And I heard that term and I said, wow, that sounds a lot like what genetic counselors do. So I've kind of adopted that into my vernacular and how we talk about, supporting individuals. And so I've just included a few things here. When I was making this presentation, I was trying to reflect on ways or questions that I had been asked that I felt like I was helping people navigate the world that have Pompe disease. Um, so one thing I help out with a lot is family planning. So these are all examples of questions, like I said, I have been asked or would be very appropriate to ask me or your genetic counselor. What's the chance I'll have another child with Pompe? Or what's the chance if I have it, my sibling might also have it? What options do I have to reduce the risk of having a child with Pompe disease? Can I do IVF? Can I use a sperm donor? Can I do this? So those are all questions that genetic counselors can help with. I talk a lot about social life because life happens, all of life happens outside of a medical clinic, right? You spend a very small portion of your time there. How do you navigate the rest of your life? How do you explain Pompe disease to other people? Or, just how can I best live a normal life? Um, or what does that look like for you? Sometimes people have life changes coming up. I want to get married or go to college or move to a new place and I need a new doctor. What do I do? So those kinds of things, I think genetic counselors are really uniquely suited to help you out with. Of course, your physician is always the one that's going to make any medical changes for you based on any physiological differences. But we also know there's a huge mental component to different changes that the body goes through, whether it's a child growing up and developing, going through puberty, someone going through pregnancy, or even an illness, can all have a really, different effects on the body and the mindset. And so these are things that we as your medical team want to know about. And while your doctor might be able to help you make adjustments to your treatment plan or regimen, I think genetic counselors can also help you kind of adapt psychologically to what that actually means in the context of this condition. We talk a lot about the future. What can we expect? Oftentimes the answer is I don't know, and that's always difficult to give. But what I can say is here's what we do know. Here's what we can predict based on the information we have. Is there anything you can do to plan ahead for yourself or for your child? Will there be any surprises? Is there anything I should be on the lookout for? These kind of anticipatory questions come up a lot. And I think like I said, the reality is most of the time, we don't know. We can't always predict the future, but it's very normal to have these questions. And I still think that even if the answer is I don't know, I still want you to ask them and have that conversation with your team so you understand what to expect. And finally, emotional support. So counseling is part of the name for a reason. So some people have, say might come to me and say, I'm having a really hard time adjusting to my diagnosis or my child's diagnosis. Sometimes postpartum depression and anxiety come into play with that too. Some people feel very isolated and say, I really want to connect with other parents or other people of my age that have this diagnosis. Or some might even come to me and say, I need more support. I need something more than this. In which case I can usually say, here's a referral, or let's talk about what you need. So yeah, those are just a few examples. I'm sure there's probably a lot more. These are the ones that come up the most often. And these are all ways that I think genetic counselors can be an important part of your medical team that these questions otherwise might not get answered if you have a very short time to spend with a physician. All right, a couple more slides before we move on to Q&A. So these are just kind of my, tips for your genetic counseling visit if you've never been or you want to think about your next one. If you've ever had genetic testing done, do your best to bring a copy with you, whether it's on your phone, a printed copy, email it to me ahead of time. That's so, so helpful to have on hand because the last thing I want to do is order a test for you that you've already had. Then your insurance comes back and says, nope, we've already paid for this. We're not going to do it again. And that's very frustrating. So I always try and encourage that. Or if you know who has a copy, let me know. I will call them and get them. Be prepared to provide a family history. This is a big one. So oftentimes I'm asking people, all the questions for their pedigrees, and they say, oh gosh, if only I had just talked to my sister before I came here, or something to that degree. So yeah, go ahead and one, be prepared to give this information and maybe talk to your family members ahead of time if you want some clarity on a potential diagnosis, or just other family history. It's good to ask that ahead of time and be prepared to talk about it. It may feel really tedious to answer all of these questions. This information is really important, not only for us to make the best decisions about your care, but also for us to document everything appropriately so we can have our best chance at getting coverage for genetic testing or whatever procedure we need. I like to encourage people to bring a friend or family member, one, to keep you company during your visit, and two, if I'm giving you a ton of info, you might not remember everything I said, but your friend might. Or in general, just having a support person can be really powerful, depending on the individual. I love when people write down questions ahead of time. Sometimes people will come in and have a notebook and they'll check off questions as I answer them, or they'll ask them of me or the provider if I haven't covered them yet. And so that's always nice. It's never offensive. It's really great to kind of have that ahead of time so we can make sure in the limited time we have together that you do get your most important, burning questions answered. Yeah, so speaking of, ask the questions. No question too big or too small. There are certainly no dumb questions, and I really do mean that. When in doubt, just ask, if it's something you saw online or something that you personally have a question about. The last thing I want is for you to leave the visit and go, wow, I wish I had asked this. Um, you know, it is this is why we're here. This is what we're here for. So always, always ask us if you have something on your mind. A few last kind of FAQs, again, just thinking about questions that people have asked me before, and maybe some of these are in the Q&A box right now, I'm not sure, but I'll go ahead and go through my common ones. The first couple are about insurance. Will it cover genetic counseling visit and will it cover genetic testing? And the short answer that nobody's going to like is that it depends, especially the genetic counseling visit itself, because different hospital systems bill for genetic counseling in different ways. So it's always good ahead of time to call your insurance provider before your appointment to see if that's something that's routinely included. That might not be feasible for various reasons, but most institutions will have some kind of financial care counselor that can help you navigate that if you were to get a bit of an unexpected bill. But depending on the system, sometimes the genetic counseling visit is billed separately from the doctor's visit, just like something like PT would be billed separately or speech pathology would be billed separately because it is a separate service. Just because it happens on the same day doesn't usually mean it gets lumped in. But like I said, that can actually vary between hospital systems. So definitely check on that if that's something that you're interested in. As far as insurance coverage for genetic testing, if there is adequate medical reason, like usually for cancer genetic testing, for example, there's certain criteria you have to meet for something like Pompe disease testing or whole exome sequencing, something bigger, then there needs to be usually enough reason to justify it. Going back to documentation and why that's so important. That's something that we try to help you navigate. One thing I like to do is I'd like to see what kind of health insurance do you have. And oh, I know this particular lab, is in network with this insurance, so I'll use that one. There's all these different testing laboratories out there, and so I always try and use the one that I think is going to work best with your insurance. This question is really good. I get it all the time. Will I be denied or can I be denied health insurance if I have a genetic diagnosis? I get a positive test result. And so there is a federal law, and this is in the United States, known as the Genetic Information Non-Discrimination Act, or GINA, that does prevent health insurance companies from discriminating against individuals with the genetic disease. So this basically means if you were to go, to an insurance company and try and get health insurance through your job or even on your own, they can't deny you health insurance because of a genetic condition or necessarily make your rates higher than somebody else's. Um, it doesn't apply to supplemental insurances, like life insurance, disability, or long-term care. So some individuals will actually try and set all of those up before they go in to get genetic testing. But it all depends, those kinds of insurances depend on so many different factors that genetic testing is only one of those. So when it comes to insurance, I always say, try and talk to somebody that works in that industry that can answer your questions probably better than I can, but this is just kind of a bit of information there. The next few questions I get a lot about I call it recreational genetic testing, so things like 23andMe, Ancestry.com. If I'm ordering clinical, like medical genetic testing for you, that's not going to give me any information on your ancestry, sadly. Uh, or any other like health risk information that you might get from 23andMe or whatever. So the testing I order for you is going to be the medical information only. And usually when it comes to pre-test counseling, that's when I want to say, here's everything we can learn. On the flip side of that, some people say, oh, well, I've already had genetic testing. I had the whole thing done through 23andMe. Can't you just look at that data instead of ordering, a new test? And because the methodology of testing for 23andMe is very, very different than what we're doing medically, and that is not sufficient for what we're doing. Even if you have a test result from, let's say, 23andMe, I'm not super sure everything they're testing for these days of a genetic condition. I'm still going to order a confirmatory test with a medical lab to actually confirm that result. So no matter what, we'll probably be ordering a medical test if there's an actual medical concern. Is there information at risk? So another thing we hear about with these recreational testing companies is, the buying and selling of personal data or people unexpectedly finding out things about their family that they, didn't, really sign up to learn. And so when it comes to medical genetic testing, just like any other blood test, X-ray, any other thing you get, those results are confidential and only accessible by the testing laboratory, you and your healthcare team. Occasionally, laboratories will say this in their consent forms, that they will often use like de-identified samples to run like quality internal controls. But that's something, if you have concerns about the use of your sample or the use of your data, always ask your genetic counselor is a perfect person to ask about that kind of information. It's usually readily available from the laboratories that do the testing. But the short answer is no, we're not selling your genomic data to anybody. There would be no way for us to do that. If genetic testing is negative, especially if you have like a big test, like a whole exome or genome, does that mean I have no chance of having a genetic disease? While genetic testing is obviously the most advanced it has ever been, it's still not 100%. So this could be because of technological limitations, or maybe there's a gene mutation in a gene that I don't even know exists yet that could cause disease. So even if you have negative test results, you should still follow up with all of your medical providers because there's lots and lots of different contributions to disease, not just genetic. And finally, is genetic counseling the same as therapy? I think the word counseling in the name often throws people off, but no, it's not the same. So genetic counselors are trained to provide, psychological support, but can't provide ongoing psychological care. So I'm not somebody you would come see for like therapy sessions or like recurrent counseling. I'll see you when you come see your geneticist, or if there needs to be, a specific appointment for test results disclosure, something like that. But we aren't really mental health providers in that way. Um, However, one thing I can do is talk to you and your doctor and say, oh, well, should we place a referral to a psychologist or psychiatrist? Do we think that's the right decision for you? So that's something I can certainly help out with as far as like referrals go and getting resources. Um, I've had more than a handful of people decline genetic counseling services or decline my appointments when they come because they say, "Oh, I don't need therapy. I know my diagnosis. I'm good. I don't need that." But I hope it's been clear of everything we've talked about. That's not really one, that's not really what I'm offering, and two, that's not all there is to it. There's a ton of information that we can provide that can be beneficial. Even if you don't think you need counseling, in the sense of the word of like mental health counseling, you might still need counseling on here. Let me explain this diagnosis, or let me provide you support on how to navigate this clinic. So yeah, I always like to make that clarification. All right, I think we're doing okay on time. Just wanted to say a big thank you to the AMDA for hosting me today, and special thanks to Matt, of course, for setting up the Zoom and handling all of the logistics. A thank you to Tiffany and her wonderful family, for welcoming me into this organization, and trusting me to address this community that's become, so important to me. And you all welcomed me as actually a pretty new genetic counselor. This is the start of my career, and so it's always very humbling, and an honor to be included, um, and allowed to present to you also. So thank you so much for tuning in. And with that, I think I can move on to Q&A. All right, let me get out of the Zoom real quick, or out of the share. All right, great. Let me just pop into the Q&A box here. All right, so one question that's asking about modifier variants. So this is a really, really good question. And another reason I think genetic counselors are important, because I did mention the three types of results we can get from genetic testing: positive, negative, and variant of uncertain significance. There's another type of genetic variant we can look for, something called disease modifier. So on its own, it doesn't cause Pompe disease or whatever disease. It can't cause it on its own, but when it's seen in combination with a gene mutation that we know can cause Pompe disease, um, it can, like, say it can make, a slightly earlier onset or a slightly more severe presentation. So that's something that, it might not necessarily change your disease management, but is really, really good to know for your care team, from that standpoint, to say, okay, this person might have more severe disease, or this person might have less severe disease based on the presence or absence of this modifier variant. So if that's something that has been brought up to you, either you've been tested for it or somebody said you should get testing for it, definitely would recommend talking to either your genetic counselor, or your geneticist, to figure out, like, what does this mean in context of your specific mutations, because it can be different for everybody. So that's a really, really good question. All right. Another question says, I have my mutation testing, wondering if you could help parse the data. That's definitely something your genetic counselor can help with. It's not something that I am personally able to help with right now. I wish I could help everybody on here, but definitely send a note to your medical team. And if you don't have a genetics team, because I've been kind of assuming a lot of people do, but the reality is a lot of people get a diagnosis from somewhere else and have not seen a geneticist before. And if you haven't, even if you've got your diagnosis, even if you've got a good treatment plan and you say, I feel great, I think I'm okay. I don't need a geneticist. I think it's still really good to have one, even if you only see them once a year or every other year. Specifically because we're so well trained to look at mutation data and explain to you what those results mean. So I would definitely encourage you to seek that out if you don't have somebody on your team like that already. I really like this question. The geneticist I have knows about Pompe, but is not too well versed. Are you able to act as a liaison to them and keep them, up to date on new treatments, gene therapy, clinical trials, all these things? So definitely I get this question a lot where people say, I have a great doctor, but they just don't have, a lot of knowledge on Pompe. It's not something that really gets covered a lot in medical school, especially if you're seeing just like a primary care provider. I find that most people are really interested in learning more. And so there's usually resources. I think AMDA actually has some really great documents that explain Pompe disease that you can share with your provider. And anytime you see your geneticist or your Pompe specialist, you can ask them to write, maybe a paragraph in your clinic note to say, here's all the new, treatment updates. And then that way it's coming from the medical provider to medical provider. So that communication can happen via clinic notes. All right. Another question about seeing a genetic counselor sooner than seeing a geneticist because of less wait time. Also a really great question. Um, and it's going to vary depending on where you are. So there is a website. If you actually just Google find a genetic counselor, and I can certainly send this link out later. You can find people in your area. Some of them are able to see patients independently and some are not. So if you already have a diagnosis, you'd have a much higher chance of seeing just a genetic counselor sooner than seeing a geneticist. But use that website, see what's near you. And if you're not able to find somebody, I don't know, maybe Matt, you can help us communicate, and I'm happy to send that website and see if you can find somebody near you. All right. The last question is recommendations for treatment management. And with that, I will say that that's not something that genetic counselors are qualified to say, this is the time you should start or this is the medication you should start. Absolutely, you should see a geneticist or other provider that specializes in Pompe or this type of medication. And usually in that, you will see a genetic counselor as well who can answer some of those other questions too. So that's always my biggest piece of advice. If you want to see a genetic counselor, a lot of the times you also have to see a geneticist, but that's not always the case. Right, I think I covered everything in the Q&A.
Yeah, I actually think this might be a perfect time to stop. We have about a minute left, but thank you so much, Erin. This was a wonderful webinar. And if you want, I can reach out to you. You can give me the website and I can push it out to everyone that attended today, and we can get that going. But
That sounds great.
awesome. So this concludes today's AMDA webinar, and thank you for participating. And we'll see you next time.
Thanks, everyone.